Okay. So, when we do therapy, now, this is going to be interesting. How many of you do assessment before you take one breath into intervention? How many of you do assessment? Good, 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 wonderful. May I please encourage people, all of you, to do assessment. Here's why. Imagine this. Imagine you have a terrible stomach ache. You call your doctor. You go in to see your doctor. The doctor says, "What's the matter?" And you say, "I have a stomach ache." And she says, "Oh, no worries. Roll up your sleeve. I've got the perfect thing for you." Gives you a little injection. Okay, see you in 2 weeks. That's what we're doing with couples when we don't do assessment. We don't know specifically what it is we're treating. We don't know where their strengths are, where their challenges are. So we do assessment in our work. It is such a lifesaver for those of us who can't read minds. It really helps. So we do it in 3 sessions. The first session, we do what brings you here, that narrative. The second piece of that, we roll it in to tell us, how did you first meet? We have an oral history interview. And that oral history interview is really about the history of the relationship. We ask them how they first met. We ask them what were their first impressions of each other. How did they decide to commit to one another, if in fact they're committed? What happened when they had kids? Those questions are huge. They predict with 90% accuracy how they answer those questions, whether couples are going to stay together or not, if they don't have intervention. It's not the specific answers, it's how much fondness and admiration are you hearing? How much chaos are you hearing? How much glorifying of the struggle are you hearing? Very, very important, these little components of how they tell the story of who they are as a relationship. In addition, we ask people to just do 10 minutes while we're flies on the wall, speaking about a problem they have, trying to solve it. And we watch, do they have the 4 horsemen? Or are they beautiful in conflict management, mainly because they haven't talked to each other in 80 years? How do you know? How do you know that when you begin intervention? So really looking at how they actually talk about a problem is really helpful. In the second session, we do 2 individual sessions, and we look at things like any affairs? How about any unwanted touch, i.e. domestic violence? How many of you ask an individual in your relationship work whether there's been unwanted touch or hitting? Good, good. Good. About 50% of the couples sitting in front of you have had a domestic violence episode. That's what we're estimating. Important to ask.